Now. All right. Welcome and thank you everyone who decided to join today's webinar. We are going to talk about navigating skin picking together, a support webinar. My name is Dr. Sophia Wenzler. I'm a licensed clinical psychologist and clinical lead at Skinpick, the online therapy program that is bringing this webinar to you. The presentation is going to be 40 to 45 minutes long, and I really want to encourage you to stick around because at the end we're going to have a Q&A session as well. So without further ado, let's jump right into it. So support when we're talking about skin picking, obviously can be looked at from two perspectives: the person suffering from the skin picking and the people surrounding him, his or her loved ones. So in the beginning, we're going to talk about sharing about the skin picking, which is obviously from the perspective of someone suffering from skin picking. And then we're going to look at two groups of the loved ones around them. One would be partners and friends and families. And we're going to talk about how to talk about it, how to help and how to set healthy boundaries. And then there's a special group, which are parents of children, teenagers, or adults that suffer from skin picking. And there it's a little bit different. So we're going to talk about feeling guilty, again, how to talk to a child about skin picking, and then how to react when it actually occurs and you're around. So I'm basically addressing like subgroups in the listeners, but I think every part of it is going to be interesting to each and every one of you. And then we're going to conclude and move on to the Q&A section. All right, sharing question mark. That is a very sensitive topic for a lot of people suffering from skin picking. There are a lot of very understandable reasons why people are hesitant to share about the skin picking. Maybe you've always felt self-conscious about it. Maybe you feel it's more like this giant secret that nobody should know, that you're supposed to hide. Maybe you feel like other people would never understand or would expect you to just stop doing it. There's lots of reasons, that stop us from doing it. And to get the most out of this webinar, I always want to encourage each and every one of you to actively participate. So think about it for a second. How much are you sharing about the skin picking? With who are you sharing? And if you're hesitant about it, what are your reasons? What do you fear will happen? And I want you to keep those reasons in mind as we move along. So obviously I am heavily pro-sharing. I'm a therapist. That might not come as a surprise to you. And I think sharing can be very healing, and I want to explain to you why I think that way. So when we think about sharing about the skin picking with others, oftentimes examples of thoughts that might come up are, they won't understand, nobody can know, they will expect me to stop, what if they see my scars, all kinds of, fears that we have. But that's only what happens on the surface. If we go a level deeper, then those thoughts also tell us something about the way we think about ourselves, deep inside. What lies beneath those predictions of what other people might think is what we think about ourselves. And more specifically, I like to talk about this part of ourselves as, like, I call it the critical voice, or like, I didn't invent it, like we call it the critical voice, and we all have it. This one voice inside ourselves that puts us down, that makes us feel bad about ourselves, that demands a lot of ourselves. And that critical voice is telling you skin picking is bad, there's something wrong with you, you can't stop, this is a weird habit, you're so weak, and nobody can love or accept you the way you are, with this habit. And this this inner critical voice basically is what stands between us and the ability to share this vulnerable part of ourselves. However, and that's the important part, when we decide to keep the skin picking a secret from someone who's really important to us, then we're basically confirming those beliefs about ourselves. We're strengthening this inner critical voice by acting the way this voice wants us to act. And the way that makes us feel is ashamed, guilty, frustrated, and helpless, almost like a little child in front of this, inner bully. This inner child is this part of us that we also call the vulnerable part, the vulnerable child. And yeah, this is the part of us that feels ashamed and guilty and helpless. But the fact that we feel that way doesn't mean that we cannot, set boundaries to this inner critical voice. And that's where the sharing comes in. Okay, I hope you're following to this point. When we decide to not share about something that plays an important role in our lives, then what we're telling our inner vulnerable child ourselves is there are parts of me that no one is going to love and accept. I have to hide those parts. However, if we decide to share, obviously, in a not with everyone and not everything, but if we do share something and the other person reacts in an accepting way, then the message to our inner vulnerable child is this is nothing to be ashamed about. You're just as important and worthy as everyone else. This is a medical condition. It's not your fault. If another person will distance themselves from you or shame you for skin picking, it's better you draw a clear boundary. You deserve to be loved and accepted. This is the message we're telling ourselves when we decide to share, when we decide I don't have to hide this. This is okay. And that's that's the main reason why I am pro sharing. Obviously, there is a lot of research about it, and we know, it's good for you. It contributes to destigmatization. One of the reasons why sharing is so difficult is there's a lot of stigma around skin picking. And the more people open up about it, the less stigma there is. Only if you talk about it can you get support and love. It also contributes to connection. It can be very helpful to feel understood, validated. You can feel less alone when you're sharing. It's a sign of trust, to the other person. It can, they might even perceive it as a compliment. And also, you're normalizing it. So we all have this vulnerable part in ourselves. And we only can truly connect to other people if we share it, as is depicted in this very, very beautiful installation from the Burning Man. Only real connection only comes from there, from connecting, from sharing the parts of ourselves that we feel self-conscious about. But obviously, there's ways to do it. And I want to talk about that. You have to decide where to draw the line. You have to be very, very clear about boundaries. And when we talk about healthy boundaries, those look very different for each and every one of you. So again, I want you to be practical, okay? I want you to, ideally, I would want you to leave this webinar with like the thought in mind of a person or a place where you would like to share about your experience, and then do it. And to prepare for that, really think about the next few steps in terms of your life and where you could open up a little bit more. So when you think about sharing and the boundaries that you want to kind of design for yourself, then the first question is obviously with who? And now maybe you already have a loved person in your life, or a person that you feel close with, that you always thought I would want to share it with them, but you've never done, and now is your opportunity. But also if that's too much for you, you can think about sharing with a therapist, in a support group, in an online forum, small steps, whatever seems possible for you right now. And then the second question is, what do you want to share? Think about it. Do you want to just say, I suffer from this medical condition, it's called skin picking, and that's it? Or do you want to share a little bit more about how it makes you feel, how it came to be, when you started, your history? And the third part, anchor, it basically means, that you should know those things before you start the actual conversations. You should be very clear about what you feel comfortable with and what not. So when you're actually in the situation, you are very aware of your boundaries. And if someone, asks a question that you don't feel comfortable answering, that you are prepared, and I will not, cross your boundaries in the spur of the moment or when you're put on the spot. Then the fourth point would be share casually. And what I mean by that is sharing in a way where it's not, as if you were talking about this big dark secret, but, a medical condition that millions of people suffer from all over the globe. Don't feel like you have to explain yourself, make excuses, or that you are asking a lot of the other person by listening to them. And because you deserve an empathetic and non-judgmental reaction. If you're not, that's not what you're getting, you should rethink your relationship with this person and your own boundaries. And the last step would be just, set the right expectations. Think about with who you want to share, who this person is. You shouldn't be embarrassed, but you never know. You cannot control how the other person reacts. So think about it a little bit. Think about what goals you want to set for yourself in this conversation, and think about how you're going to deal if the outcome is not exactly what you wished for. Maybe just, maybe just thinking about it and considering the fact that the other person might not react the way you want them to react is enough. Maybe you want to just, have some kind of security net in place where afterwards you're planning to go out with a good friend, or you gonna walk your dog, do something that in case the conversation is difficult, is gonna make you feel better and kind of like catch you in your fall, in the sense of a security net. And just as a little motivator, I wanted to just present to you a few personal experiences of people who decided to share about their skin picking. This is not from my clients or patients. It's actually a post I read on Reddit that I thought was very beautiful. There was someone posting into this group of people suffering from skin picking that they were anxious, they were in a new relationship, they didn't know how or whether to share, about the skin picking with their new partner. And there was a long thread of beautiful messages of people, with like all kinds of encouraging messages. And I copy pasted two of them here that I found that I liked. So the first one, my partner asked me once early in the relationship about the open wounds on my face that I had after a horrible episode of picking. I told him honestly what was going on. He has been nothing but kind and loving. He will very gently ask me occasionally how I'm doing if he notices the picking is worse, and celebrate with me when it's better. He had never once looked like or said anything to make me feel like my scars were a turnoff for him. I know he's sad to see my pain, but he has always been super sweet about it. So I think this post shows how sometimes, your expectations can even be, the people can even go beyond your expectations. Can you say that? React more positively than you would expect, and how sweet and caring people can be when you actually open up. And then there's the second one. your partner is going to have something they perceive as a major flaw as well that you think nothing negative of. For instance, my husband is so insecure about his teeth, and I'm so insecure about my picking. Neither of us ever think negatively about the others, and definitely never mention it. And when I think about how I feel about his teeth, I just think, oh, this must be how he feels about my picking. Indifferent, concerned, and loving. And I think this is exactly, what I think of when I see, again, this installation from the Burning Man. It's when you open up, the other person opens up, and we all have something that we feel vulnerable about it. And once we share it, our connection just becomes deeper and more meaningful. Yeah. That's all I have to say about sharing. I hope you all have a mission now in mind, and feel a little bit encouraged about this very sensitive and frightening topic. And now we're going to move on to the group of adults who have an adult person that they love who suffers from skin picking. And we're going to, first of all, think about how you can talk about this topic with them. So for those of you who maybe haven't, talked about this at all, who maybe only have a suspicion even, that their loved one might be suffering from this condition, then I want to encourage you first and foremost to educate yourself. There's a lot of misconceptions about skin picking, and knowing about it, learning about it really, really helps to know how to address it, to choose the right words, to be open and non-judgmental and understanding. And there are many sources of knowledge on the internet, obviously, or in literature. Here at Skinpick, we do these monthly webinars that you know of because you're here. You can see them all on our YouTube page. You can read our blog. There's even blog posts for, loved ones of people suffering from skin picking. There's also forums where people talk about their experience and many other opportunities. So that, in my opinion, would be the first step, because as I said, there are a lot of misconceptions. Just, I think last month or in one of the previous months, we had a whole webinar on facts and myths. And one of the key takeaways that I just want to repeat here quickly are skin picking is not a bad habit. It is a medical condition. Cannot just stop. Skin picking is not a form of self-harm. People don't do it to seek pain. Skin picking can occur in all areas of the body and break out at any age. It is not a rare condition. Prevalence is actually similar, or in some studies, even higher than the prevalence of OCD. Prevalence means how many people in a population suffer from it. And it can be hard to live with, but it is definitely treatable. There are treatments for skin picking, such as habit reversal training that we do, for example, at Skinpick. Also, I just realized, because I see two questions in the Q&A section, that I completely forgot to tell you about the fact that if you have a question for the Q&A at the end, then please write it down in the Q&A section during my presentation, as two people already did, or at the end. Don't raise your hand, please. Just write the question down, and then I will get to as many questions as possible. All right. So first step, educate yourself, right? As a loved one who, as a person who has a loved one who suffers from skin picking. The second step, when you are having the actual conversation, is validate. And now I know validation is talked about a lot on social media and all kinds of places, but this is that a validating communication style is an actual therapeutic technique that I want to talk to you about, okay? So first of all, validating means to listen or talk in a way that makes the other person feel like their feelings, experiences, or perspectives are valid and make sense. So it's the opposite of making them feel ashamed, alone, or as if they were exaggerating, as if they were experiencing was disproportionate. And this is actually, I mean, to be perfectly honest, as a therapist, I do this all the time. I always try to remember those rules. And even if you don't know anyone who suffers from skin picking, not suffer from it yourself, it's just a really good way to make another person feel understood. So if there's anything I would want you to take from this webinar, it would be how to communicate in a validating way. And we're gonna practice that now. So first of all, let me explain to you. So a validating communication style starts obviously by listening. And let's go through the using the following example. Let's say your loved person who suffers from skin picking comes to you and says, I'm so frustrated. My day was fine. Work was fine. All is fine. But when I went to the bathroom after lunch, I picked around my fingernails again. I just couldn't stop it. Now, first of all, you want to show them that you are listening, and you can do that obviously in a non-verbal way by nodding, eye contact, turning the TV off, putting your phone away, um, turning towards them, showing them I'm all yours. I'm 100% listening to you. Then you can even make them feel more like you're listening to them by paraphrasing. So paraphrasing means I should just stop, talk slower. Anyways, paraphrasing means saying the same thing again in different words. So a paraphrase for this example would be, I can see how frustrated you are. Everything seemed fine, your day, work, but then it still happens, although you don't want to. And in this paraphrasing expression, there is even an additional detail. The person says, I picked up on the fact that you are frustrated. You didn't tell me that you're frustrated, but I can notice it, and now I'm saying it for you. Another way, if paraphrasing is not for you, would be just to ask questions, non-judgmental questions. For example, what happened at lunch? How did you deal with it? How did it make you feel, in case you don't know how it made them feel? Just be very present and show that you're listening. And then comes the making sense of what the other person is going through. You're making sense of it for them. You're showing them that it makes sense to you. So you can just validate the feeling. I can understand that you feel frustrated. If I was working so hard on trying to cope with a condition like skin picking, I would also be upset when it happens again. So the strongest way to make the other person feel like what they're going through, their experience makes sense, is saying, I would feel the same way if I was in your position. It's very easy and very powerful to say that. I feel the same way. A lot of people, I cannot imagine that anyone would feel differently if they had the same experience as you have had. However, there's different ways as well. You can validate based on another person's past or based on their condition, specifically based on the skin picking. When you have skin picking disorder, it is normal that you sometimes pick without noticing or that you have a hard time stopping yourself. I mean, come on, that's part of, the problem. Why don't beat yourself up about it? Just keep working on it. Or when you were small, you used to pick in the bathroom to hide it from your parents. Of course, now the bathroom is kind of a trigger for you, which shows, I know you, I know your past, and I know why specifically this experience is hard for you. Then you can validate based on the situation, which again shows that you were listening. You're saying everything is fine, but I know you're still new at this company and trying so hard to show your best side all the time. It makes sense that when you are uninterrupted and alone, that you would pick to quickly just relieve some of the stress. I'm putting myself in your shoes and I'm trying to understand, why this situation made you feel the way it did. And now you might think, okay, well, but if I always, validate everything, I mean, in the end, I want to encourage them to get better, right? If I just validate it, well, doesn't that mean I just, we're just going to stay at the same spot, but that's really not it. And also, I mean, you're not gonna, it's a person suffering from skin picking has to learn to cope with it themselves. That's not your job. I'm going to talk about that more later in the presentation. But anyways, validating doesn't mean that you don't see space for change. And sometimes you can even combine validation with motivation. You can validate and give a perspective of change. I can understand how frustrating it must be to try so hard to change and then catch yourself picking again. It's because I see how much this weighs on you that, and whatever you want to motivate them to do is, I want to help you. I want to encourage you to try HRT. I am giving you this fidget. You can also combine it. Yep. So those are the validation strategies. You can obviously find this also online, but I just want to go through it one more time with you so you don't forget. And this time I want you to actually practice yourselves some of those strategies. So I'm going to just pause for each strategy a little bit, and then I'm going to let you try to, practice with yourself with this new example. Okay, so the new example is, I don't want to go to the party. Everyone will see the spot on my arm where I picked. Now, first of all, think about a way that you could paraphrase that if someone was saying this to you. Okay. One way you could paraphrase that would be, I see that you are really anxious about what people will think at this party, so much so that you don't want to go at all. Again, kind of, identifying the emotion for the person talking to you. Second step, validate the feeling. So that one doesn't have to be complicated. I can totally understand that. I would be nervous too. Again, if I was in your situation, I would feel the same way. Very easy, very always makes the other person feel good. Very rarely fails. Oops, now I gave the solution already. No. Validate based on the past. Try that out. So that could look like, I know that in the past people have asked about your skin. It makes so much sense that you would be nervous. Validate based on the condition, on the skin picking. Many people suffering from skin picking are anxious in social situations. Totally true. And then validate and motivate. Because I see how hard this is for you, I think you are so brave for thinking about going anyways. If you do decide to go, I think you will be really proud of yourself afterwards. It makes total sense that you feel the way you feel, but that doesn't mean that you have to act on this feeling. All right. So, to conclude, when we talk about it, we want to be informed and we want to talk about it in a validating way. Now, the big question, how can I help? Can I help? And I think, if you're an adult and you have another adult in your life that you care for who suffers from skin picking, then there are three things you can do. First of all, you can ask questions. A lot of people are hesitant to do that, but actually it's always a good idea to ask questions very, carefully, because it's easier for someone suffering from skin picking to be asked than to have to open up on the issue themselves. And if you don't talk about it, they might feel like you're, hesitant or talking around the subject, which might even increase feelings of shame or embarrassment. Then be non-judgmental, you know, treat skin picking like you would any other medical condition, such as asthma or diabetes or an allergy. And never assume that, you know, you have to find someone to blame. The same way you wouldn't find someone to blame for suffering from asthma. And then you can support and encourage basically based on what they need. Don't think that you need to know what to do to help them. Ask them what they need. Do they want to talk about it? Do they need help, you know, finding therapy? Do they need you to tell them when they're picking? Do they need you to just, you know, respect their boundaries and not talk about it? Whatever is right for them. Everyone wants to be supported in their own way. So just ask them, you know, you don't have to know by yourself. And lastly, it's also very important to set boundaries. Just like someone suffering from skin picking has to have boundaries when it comes to how much they want to share, you have to set boundaries as well. If you want to look at it graphically, you know, you have this person that you love, and you have this skin picking disorder that can be, you know, very difficult to deal with sometimes, and it can even affect your relationship. So that's why a lot of people kind of try to step in the middle, you know, and kind of try to manage it, you know, for their loved one, just in order to help them be happier. But that's what I would advise you not to do, because first of all, you're setting yourself up for failure. You cannot just take it away from them. It will negatively impact your relationship. And most importantly, if you go in the middle, you cannot, you know, your loved one cannot, you're basically in the way of them learning to deal and cope with it themselves. And that's specifically important for parents, obviously, because all a parent wants is just, you know, see their child happy. So it makes perfect sense, but it's not helpful. So instead, you know, you can be next to your loved one, you can have their back, but you don't treat them, you don't manage their emotions for them. If a thought like, if I make her angry, she will pick comes up, no, don't walk on eggshells, you know, be the person you are, be in the relationship as an authentic person. You don't take responsibility for when they pick or not, and you choose to take care of yourself first. You know, your partner or a friend or family has nothing, you know, has nobody left if you don't take care of yourself. And that can mean all kinds of things. That can mean that you maybe need, you know, a date with a good friend, that you need therapy yourself, or that you need a support group. It's very important that you know, take care of yourself first. All right, how are we time-wise? Ooh, okay. Gonna try to not go over time. So parents, that is also that is another specific group amongst the people that have loved ones that suffer from skin picking. So first of all, the guilt question. A lot of parents, when they, you know, seek parent counseling, or when they bring their child for therapy, it doesn't even matter if it's, you know, skin picking or any other problem, they ask, you know, is it my fault? What did I do wrong? And so first of all, it's very important to know it's not your fault, and it's not your child's fault. Skin picking doesn't have one cause. You know, there's many things that contribute to to people starting skin picking and to it becoming a medical condition. And that can be self-regulation problems, intense emotions, genetic, neural attributes, It can be temperament, age of onset, a lot of things. And also research is not 100% sure. It's not math. It's not take 1 + 1 + 1 and then it equals skin picking. So there's really, really it doesn't help to ask the guilt question. It's nobody's fault. But it is your responsibility to help your child cope. You're the parent and you have a lot of space there to help, and to influence your child in a positive way. And the most important parts are nurturing and responding to their needs and helping them regulate their emotions. So we want to be a warm, caring, stable parent that helps them regulate their emotions. And I'm going to give you some tips on how to do that as well. So just some specifics. Obviously, also when you talk to your child, you want to be validating, you want to listen, but there's some questions that almost all children ask when they suffer from skin picking. And so the first question would be, what's wrong with me? Because you cannot expect your child to know what's going on with them. They're just doing this and they don't understand why they can't stop. So it's your job to make them understand. Wait, what just happened? Oh, there we go. Sorry, I had a problem with my screen. I hope you guys can still see the screen. So it's your job to help them understand that they are suffering from a medical condition through no fault of their own. And you can do that by normalizing their experience. Did you know that many other children and adults have the same problem as you? And you can even kind of translate, the numbers that we have from research so they can understand. You know how you have 100 kids in your year at school? Did you know that probably about 60 of those 100 kids also, at some point picked their skin or pulled their hair or bit their nails? And did you know that at least 4 other children in your year have the same problem you do, that they cannot stop? You're not alone. It's just that you don't know because people don't talk about it. Or you can normalize in a way that you talk about yourselves, just like I need glasses because I have an eye condition, you have a different medical condition. We just need to find the right treatment for you. The second question that a lot of kids ask themselves is, why do I pick? And then again, it's very important that you are informed. And by the way, a lot of parents aren't. 50% aren't even aware of the condition of their child. So the fact that you are here listening to a webinar also already means that you're, supportive and that you're trying. And so it's your job to kind of, gently explain to them it's a medical condition. It's not your fault. It's normal that it's hard to stop. It starts with an urge. The urge is felt in your body. Where do you feel the urge? And just, make them understand what's going on with them. And then the third question that a child might not be really openly asking you, but asking themselves, quietly, consciously, subconsciously is, will my parents judge me? Is something wrong with me? Do they see me in a different light now? And that's where it's really important to just show them, nothing has changed. You're unconditionally loved no matter what. Even if they hide the picking from you, even if they don't want to talk about it in the beginning, be very patient, validate, tell them about something that you once felt that you could not tell anyone, and just, make them feel loved and accepted no matter what. And finally, I mean, if you're a parent, very likely that you observe your child picking, and then it's very difficult to know what to do. Um, and I want to give you some advice on what to do, but I just want to start by the no-goes. Don't tell them to stop. It doesn't help. It's like telling someone to stop a sneeze. They can suppress it for a little bit, but then it's going to come out anyways. Don't force them to seek professional help. As a therapist working with kids, that barely goes well. And yeah, many reasons, but I don't want to go into that. Don't shame or embarrass them for the picking, and don't punish or scold. Instead, try to follow the following steps. First of all, self-regulate. You are the anchor, you are the base, you have to be calm. Take a deep breath. Your child will be okay. You will be okay. This is no one's fault. If this is difficult for you, think about things that help you, to anchor yourself and to stay calm in the situation. And then as a second step, you don't immediately need to intervene. Okay, you can observe first. What are the triggers? How much is my child doing it? When are they doing it? Are they aware that they're doing it? All of those things, just explore first and try to understand what's going on. And once you feel like you understand a little bit what's going on, you can start talking to them about it. And then what you want to do is once your child, knows what's going on and says, I want to do it less, you can create awareness. You can, that's also the first step in habit reversal training, creating awareness for the skin picking. And you can even make a game out of it. You can be urge detectives together. You can even build in incentives. For example, you play a game for an hour a day or whichever time period makes sense to you. If the child notices the urge before they pick, they get 1 point. And if you notice the picking, then you get 1 point. And if the child wins, then they get, I don't know, a sweet or something like that. It's very important that you're not expecting them to stop picking. You're just expecting them to notice the urge before the picking occurs. You can draw the urge, externalize it, talk about the urge monster that also takes away, the guilt a little bit. It's not you, it's like the monster that comes once in a while and sits on your shoulder and tickles you or whatever. And then it's really hard to resist. And listen to your child when they tell you about their experience. And then what you can do further, once there's awareness, you can have fidgets and barriers all over the house to assist your child once, the urge comes up, to not engage in the picking. If you see that your child is really, exhausted doing homework for an hour, encourage them to take a break, to listen, understand what they need and what's good for them. And obviously, don't think that you have to treat the condition, right? In the end, professional help is the best way to go. And you can offer that to them. And if they agree, then go along with that. And another thing that you can do, which is not really treating the skin picking, it's more like dealing with the underlying causes. A lot of the picking is caused by negative emotions, right? So if you help your child learn to deal with negative emotions, then you're automatically also, that should automatically have a positive impact on the skin picking. And there are 4 kind of tips that I can give you in this short amount of time that we have. So first of all, if you're noticing that your child is dealing with a big emotion, if they're really overwhelmed, if they feel like they're in a storm, then you can do a grounding technique. What I always advise is the 5, 4, 3, 2, 1 technique. So you can ask your child, let's just take a break. Bear with me for a second. Tell me 5 things you can see. And then they tell you 5 things that they can see. You can even do it with them. 4 things you can feel, 3 things you can hear, 2 things you can smell, and 1 thing that you can taste. And through the connection with your senses, this is, by the way, also an exercise that I give to adults, you're automatically more connected to the moment and you calm down a little bit. And then the next step would be to understand what's going on. How do I feel right now? And you can do that if you're creative or your child is creative, you can even build one of those round things, wheels, just like in the picture with the emotions. And they can, even if they can't talk, they can just, point at the emotion that they're experiencing. And then you're already a step further. And naming the emotion is already has a regulating effect. And then you can help them deal with emotions. And obviously, that's a huge area, dealing with emotions. That's 99% of what I do as a therapist. But just 2 guidelines that I want to give you is, obviously, there are all kinds of like little things you can do when a negative difficult emotion comes up, just like in this little graph that I copy pasted here, copy pasted, you can, take some breaths, count to 20, do jumping jacks. If the emotion is agitating you, draw, do some stretches, whatever, small tricks that just help you calm down the emotion, help your child calm down the emotion a little bit. But the most important part, that I kind of tried to demonstrate with this picture of, the baby looking in the mirror and seeing, an adult man. I imagine that that's their dad, is you as role models. We talk about education and, think how we talk to our child, how we communicate a lot, and it's important, but children learn much more in a non-verbal way by looking at their parents. Just like little, dogs learn, how to be a dog by looking at their dog mother or father, or there are better words for both of that. It we as humans, we're very verbal, but we basically work in the same way. We look at our parents and we learn from observing what they do. And so you can demonstrate to your children how to deal with difficult emotions by showing it to them in your real life. You can come home from work and tell them, wow, I had to do this difficult presentation in front of my boss. I was so nervous. I felt the fear wave washing over me. I was completely overwhelmed. But then I told myself, no, I'm not going to let the emotion take over. Makes a lot of sense that I was scared, but I was going to push through. I took some deep breaths. I went to the bathroom, came back, and then I did it. And afterwards, I was so proud. You can really show them, first of all, that emotions are normal, that you have them too, and also how you deal with them. And that might be very helpful for your child. Okay. In conclusion, what we learned today is sharing your experience with trusted people is healing. You're showing your inner child that there is nothing to hide and that you deserve to be loved and accepted the way you are. Before you decide to open up to someone else, though, decide where your boundaries are and decide how you can share in a way where you still feel in control of your own narrative. For partners and friends, be informed, try to use the validation strategies that I introduced. Ask the other person how they want to be helped and keep your own boundaries. And to parents, remember, it's nobody's fault. If you show your child they are loved no matter what, then you've already done the most important part. Answer their questions and help them deal with difficult emotions. All right. I just want to quickly remind you of our free resources here at Skinpick. We obviously have the monthly webinar. We have online forums and blogs on our website, skinpick.com. We have Facebook groups, Instagram and TikTok, where you can join, or online community, also a place where you can share your experience. And now, we're moving on to the Q&A section. We have, I went a little bit overboard. 15 minutes. I already see. Okay, can you recommend me some forums about skin picking? So I don't have one right now where I can tell you the complete name, but for example, if you go on Facebook and click skin picking, click right now skin picking. There are groups that you can join. I'm also part of some of those groups just as a therapist, just to understand the experience better. So Facebook is where I go, but we also, as I said, on our website, have a forum, and I'm sure if you Google a little bit, then you'll find some, and you will see that also those communities are very supportive, very positive communities in the skin picking and generally BFRB world, like the body focused repetitive behaviors. And blogs, also we have a beautiful blog on our website, skinpick.com. We have a forum and a blog. We have new articles coming out every month that you can also read about in our newsletter that comes out every month. Yeah, so a lot of resources there, only via Skinpick, but also beyond. Wow, such a beautiful comment. I suffer from, or question, I suffer from picking. I have never told anyone aside from my therapist. I want to tell my husband, partner. Is it recommended to educate our loved ones ourselves? The misconceptions are what I worry about most. Yes, I think that you can do that. Educate them yourself. Nobody knows better about the disorder than you. And you can also, educate them in a way that they specifically understand your experience, because it's not exactly the same for everyone. And if you have a partner who, is open and wants to learn about it, and I mean, if it's the right one, then they should, then yeah, absolutely do that. And I really, really remember, the quotes that I listed from Reddit. This was only two examples out of a really long thread. So I really want to encourage you to do that. I cannot guarantee you, but you might be surprised um, about the reaction. Can you explain how skin picking is a mental condition and not a habit or self-harm as my partner thinks? Um, so here we see clearly, how important education is. So first of all, we call it a medical condition. Mental condition also sounds a little bit like stigmatized, but it is also yeah, you can also call it like a psychological condition, for example. So it's not self-harm, because when people self-harm, they actually seek the experience of pain in order to deal with difficult emotions or inner emptiness. And they really perceive the pain as something negative, as painful when they cut themselves, for example. First of all, the self-harm usually are also different actions. It's cutting yourself, or punching, or hitting yourself, or things like that specifically seek to exert pain. So the pain kind of is what they're looking for. And in skin picking, it's not that. Sometimes it's not even painful. It's more it's a more positive experience, which also makes it difficult. Um, it's more like the feeling, like when you can explain to your partner, like it's when you sneeze and then you feel a release. That's what you feel when you pick or when you pull your hair. Whereas in self-harm, we really want to hurt ourselves to stop to add pain, to take some other pain away. Right? That's how I would explain it. And it's not a habit, because the definition of the disorder is that that it's difficult to stop, and the only way to actually stop is to replace it with something else. So it's really much more than just a bad habit. But also, if you want to explain that to them, what you also can do is you can watch, last month's webinar together with your partner. Educate, as in the comment before, educate yourself together. Maya Schonbach, or wonderful employee at Skinpick, who's also a clinical psychologist, did a whole webinar on misconceptions, and she explained each and every one of those myths very well. I'm a mother with a 10-year-old girl that has skin picking. Are these advices also recommended for kids? So first of all, I am. You asked this question before I went into the whole parents part. So, but all of the advice that I gave, for example, the validation is highly recommended also for your child, specifically if it's a girl and she's 10 and she's going to be in puberty soon. It's so important to make your child feel like you understand their emotions, even if you don't, even if you feel it's exaggerated. But like one of the core experiences of 10 early and later puberty is that nobody understands what you're going through, right? So this can be a very, very nice way to talk to your daughter. And if she's not yet on her way to puberty, good for you. And the same applies anyways. Is this webinar only for how you support others with this condition or for yourself as well? I am dealing with this myself, and I thought this webinar will give me tools to deal with it myself, not only to talk about support another person. If not, can you point me to other videos on your website or upcoming webinars that would give me strategies to deal with it? Okay, so we did advertise the webinar as for people who suffer from skin pick as well as people who support them. So I'm sorry that you kind of were wishing for more advice to deal with it yourself. I was more looking at it as a way of how can you feel supported for as a person who suffers from skin picking, and how can you support people who suffer from skin picking, like those two perspectives. But if you go on our YouTube page, skinpick, uh, skinpick.com, you will see an abundance of webinars. One specifically about habit reversal training. I think there's even two webinars, part 1 and 2, about habit reversal training, which gives specific explanations on how treatment for skin picking works. Habit reversal training is the gold standard, so that's the most effective treatment. We know that from research, and as I said, we have these two webinars that explain how it works. And also others. I did one a few months ago about how to deal with compulsions that has helpful coping strategies, and much more. We've been doing webinars for I think 5 or 6 years, so there's really a lot of things to go through, but those webinars can only take you so far. So in the end, if you want to really learn how to deal with skin picking, then I really advise you to seek treatment, and you can try out skin pick. If you do, you see we have a $100 discount code here, or seek out a therapist in your area, but that's the best thing to do. I'm forcing my girl to see the psychologist. Should I stop it? Wow, that's a difficult question to answer without me knowing her. I would ask, if you did it, on the premise of just try it out, you don't want to, but try it out. Then I would first of all check in with her, what her experience is, and how it's going for her and how she's feeling there. If she's really small, like 6, 7, 8, and she doesn't want to go, sometimes it works to work with incentives and just like really, if you go or if you do what the psychologist tells you, like make a game out of it, get stars for it, do a token plan, keep them motivated that way. That sometimes works with smaller children. As soon as they're, I would say, I mean, it depends on their maturity level, but like 9, 10, 11, if you see after a while why she still doesn't want to do it, it's not that she got to know the therapist and then she noticed, okay, it really helps me. If she still feel like you're forcing her to go there, I would advise you to stop and try again once she's a little older or a little more open towards the idea. Because I work with a lot of children, and I this is the first experience they have with a therapist, and they might need therapy again in their lives, and so it should be a positive one, so they feel like therapy is this resource that they can fall back on, and not this negative thing where you are forced to going. How come it is not OCD? Wait, how much time do we have? I think I'm going to get through all the questions. How come it is not OCD? If you are asking about the difference between OCD and skin picking, then let me explain. OCD means, in most of the cases, that I mean, the similarity is that there are there is compulsive behavior that I feel like I cannot stop no matter what. That's why sometimes people confuse skin picking and OCD. But in OCD, there's a thought coming up that frightens me, an intrusive thought, that's what we call it. And then we do something that we don't really want to do in order to calm ourselves down. So the most prevalent, no, most prevalent, not most prevalent, but the kind of OCD that most people know is contamination OCD, where, for example, I touch a doorknob and then the intrusive thought would be, oh, maybe there's bacteria or something, maybe that was dirty. Maybe now I'm contaminated and I'm going to, contract an illness. And then this thought makes me so anxious that I have to do something to calm myself down. For example, to wash my hands or touch doorknobs only with gloves or whatever. So usually there's a fear-invoking thought that leads to the ritual, and that's why the ritual is different from body-focused repetitive behavior, just like skin picking. There is one kind of OCD that's called just right OCD, where people have to, for example, touch, a pen 5 times or knock in a certain way or rhythm, or don't step on the, how do you call this? The little between the stones, on the pavement or stuff like that, where there's not really an intrusive thought. It just like, as it says, just right OCD, it just feels not right if you don't do it that way. But again, it's not the same as when you have an urge and then you relieve the urge with the picking or with the hair pulling. It's different. It's more in your head. Yeah. I also believe we have a webinar on OCD, and because there's also some people who suffer from skin picking and OCD. And so if you want to get more information on that, then watch that webinar, or you can also go through the webinar that I did recently about compulsions, because OCD and BFRBs are both compulsive disorders. So I talk about that too in that webinar. Skin picking is painful. I'm not sure that I see the difference. Um, yes, but you're not picking because you want to feel pain, right? You're picking to get rid of an imperfection or to make something better. And not because you're like completely emotionally overwhelmed and the only thing that will calm you down is feeling pain. So it is pain. I'm sorry, like you are completely right. It is sometimes painful, but it's not the pain that you're seeking. A follow-up question, and that's the last one I'm going to answer. On that note, it's about the OCD. On that note, I heard recently that OCD is more commonly associated with compulsion or symmetry, whereas skin picking is more closely associated with boredom or anxiety. Do you agree? I'm not sure if this is evidence-based or not. Wait, let me read that again. OCD is more commonly associated with. So both of them are compulsive behaviors. They're, as I said, symmetry. So the just right OCD oftentimes is related to symmetry, that things have to, for example, also where you have to order, put something in a specific order or have something organized in a specific way. And skin picking is more closely associated with boredom or anxiety. Yeah, so usually OCD doesn't come up when you're bored, but skin picking can come up when you're bored. I would say anxiety plays a role in both of them because, as I said, OCD usually starts with an intrusive thought that makes you anxious, and then you do a ritual to calm you down. And also, people who suffer from skin picking do pick to relieve anxiety. But in OCD, it's the intrusive thoughts that bring the anxiety. It's not that you do an OCD ritual to deal with stress at work, right? So, yeah. All right. I hope that answered the question. And if not, then do do go on our YouTube page, skinpick.com, and look at the webinar on OCD, or look at the one that I did on compulsions, and that's going to give you some additional information. All right. Thank you so much for attending. That was it for today. Next month, we're going to have another webinar. Wherever you are in the world, I hope you have a good rest of your day or evening. Bye.